So this patient in particular, she wasn't that worried about her arthritis. She was worried about these new nodules that were coming out, and she had them.
What do you mean by nodules? I mean,
Well, they look like little balls. You can actually feel them. They're rubbery feeling under the skin.
How do you treat it?
You treat the disease.
How long do you think it's going to take for it to go away?
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
Alex, you saw an interesting case with rheumatoid nodules. Tell me about that.
Well, you know, this patient comes to see me, and she comes from about 100 miles away from a small town, so you admire that the patient is coming from far away. And in conversation, the patient already had a diagnosis of rheumatoid arthritis. She's had this for quite a few years.
Tell me about rheumatoid arthritis real quickly, for the people at home understand what it is.
So rheumatoid arthritis is a severe inflammatory disease. It's going to cause severe swelling of the hands, the knees, ankles, and toes. It's the kind of arthritis most frequently associated with deformities and crinkling of the hands.
Where the hands look crooked and they look
the fingers
big
look
knots
crooked and big knots. And so this patient in particular, she wasn't that worried about her arthritis. She was worried about these new nodules that were coming out, and she had them.
What do you mean by nodules? I mean,
well, they look like little balls. You can actually feel them. They're rubbery feeling under the skin. They're not a boil. They're not like an infection where it's going to have a red head and it drains, although that's not impossible, but they're just a ball under the skin. And usually in a pressure area where in the elbows, people push themselves off from the tables and push themselves off from the chair. So in the pressure areas, and a big one here at the tip of the elbow, and her pulmonologist was seen her, has sent a chest x-ray that also had nodules, different balls on the chest x-ray report. So this patient most likely had a condition called rheumatoid nodules.
Okay, now, are rheumatoid nodules, do they come on suddenly? They come on slow? How does that happen?
They will happen very slowly over time, and they will happen in pressure areas, but they can happen in any organ of the body, inside or outside. So when we see these on the outside, we kind of worry that this inflammatory process is also going on inside the body.
So someone at home has these sudden nodules. They're small or they're big? How big are they?
They can be as big as they can be quite large actually, but they're usually like the size of a bean or a little bit bigger than a bean.
How do you treat it?
You treat the disease. You treat the rheumatoid arthritis with anti-inflammatory medications, with correct biologicals, and the nodules are going to go away.
They go away?
They're going to go away.
For sure?
They're going to go away for sure.
But the arthritis will still be there, but the nodules will go away.
The nodules will go away, and the arthritis symptoms in a patient that has rheumatoid arthritis for more than 10 years, the arthritis symptoms will be minimum. They're going to be minimum.
How long? How long do you think I could tell a patient, you know what, I'm going to send you to Dr. DeJesus, it looks like you have nodules, all right? How long do you think it's going to take for it to go away?
About 2 years. About 2 years.
Right. So they come on over a couple of months or a couple of years? Or?
Slowly over a couple of months or a couple of years, and they also disappear in about that
Slowly.
time. Slowly.
But you got to continue to treat the patient.
Yes, if you don't treat it, it's not going to go away.
Okay. You know, that's interesting. I mean, I see a lot of people with rheumatoid arthritis, but I never really see the nodules very much. Is that common for you?
That is uncommon. Before we had better treatments for rheumatoid arthritis, it was extremely common to see those.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.